Kia ora. So a lot of the time when we complain about lower back pain or even pain in the hips and that kind of thing, we a lot of physicians or physios, osteos, doctors all talk about how your core's weak. And that can be true. It can be multiple things, but often it's not so much that it's weak, it's just that it's probably not functioning ideally, is how I'll probably describe it. Because for you to be upright, your core has to be reasonably strong to be upright. If you're like sagged down all the time, yeah, there's probably definitely weakness in there, but your core controls the strength in this bit here, and it supports your skeleton in being able to keep you up. Okay, so it'll be probably not working ideally or functionally in the deep core muscles, which is your transverse abdominals. So that sits like a corset around your tummy, and things like pregnancy can affect it, or pelvic floor issues can affect it. Sitting all day, just being scrunched up posture can definitely affect it. Many things can affect it. But your core works in unison, or your deep core muscles work in unison with your diaphragm, your breathing, your pelvic floor. They all work together. So it's kind of like this cylinder effect, okay? So when we're trying to get them working, we want to get the breathing working properly, or best, I think, with the diaphragm. And we also want to get pelvic floor working with it. But often, sometimes 9 times out of 10 as well, the glute med isn't working that well as well for lower back pain. So there's a whole heap of things. It's not just the core that is weak or not working properly. It's a whole heap of things, because your body just doesn't shut down one area by itself. It's like a whole lot of things happening and things taking over. So quite often it's the lower back is doing too much work, and the front is just not doing what it should be when it should be doing it, okay? So we're going to start. This is very basic today, but it's just explaining what can be happening if things are feeling tight in that lower back. But if you have had an injury like a disc injury or any kind of issue like sprain or that of the lower back, it is important to actually get the core working so it takes the pressure off that lower back. Okay, so we're flat on the ground here. We want to think about the pelvis and where it's situated. So this is my go-to with pretty much everything when it comes to lining things up. So if we think about the belly button, and imagine the belly button is a laser beam, okay? So it's just going straight up towards your ceiling, and you are making sure it's not going on an angle, so it's not coming towards you, and you would also feel that your back is quite hard pushed into the ground when it does that, or it's not going away towards your knees, okay? So if we're having this laser beam, it wouldn't be going that way, and it wouldn't be going more towards your face. It will be going straight up towards the ceiling. So when you feel it go away from you, so if it's going towards your knees, you should feel that the lower back is arched, okay? You can probably fit your hands under there. You can do that now if you want. So you're going to tilt the pelvis towards you a wee bit, and you'll feel that your hands are probably getting crushed now. But that belly button should be straight up and down from this point. So we go away, and then we come back in, okay? So we've got that there, so we've got that going on. If you take your hands out, you should be flattening that back enough that it's not squishing anything down under your back. There's sort of like this light press on the floor. If it was pressed in hard out, you would feel like you're imprinting that back into the floor. We don't necessarily want to do that. We just want it to be a gentle tilt towards us with the pelvis, that pubes towards boobs, and then you should feel a very gentle activation of your tummy. And if you think of a spring, so if we take things away and then it's quite long in that area, and you've got that arch, so it's quite a long, feeling, and then as we come in towards, everything shortens up. And that's how we want to get the muscles, is you want to get them shorter to build them up, okay? So it's shortening and then lengthening here. So we go into that shorter position, and you should feel here that you're a little bit activated. And I'm talking like 5, 10, 15% of like it's not really hardcore, it's just a light feeling of activation. Okay, so we're just going to do that a couple more times to get used to it. And this is getting into a neutral pelvis alignment. And the other thing is, when we're feeling like maybe we're a bit stiff, walking around or sitting, we can do exactly the same movement with our pelvis and take that pressure off that lower back. Okay, so we want to get in there a couple more times here. Cool. So when we get people to do glute bridges, and often there's a people just want to thrust, but if you do that, you're going to feel it in your lower back first of all, okay? So you're jarring it up like that. But if we do that little tilt, and then we slowly lift up off the floor, you're going to feel it in your tummy first, so it's already on, and your bum is already on before we even lift off the ground. And as we come back down, you should feel it relax a wee bit. So if we come back up, and I know in the past, like years and years ago, before I discovered this, I used to be like, oh, my back hurts doing bridges, and I hated them. But once I started to learn more how the spine actually should be working and how much input the pelvis actually has into the mechanics and getting things working right, this was a game changer for me. And pretty much every exercise I did was making sure the pelvis is in the right place, and I wouldn't really have back pain, essentially. And I'm someone that has herniated my L5, which is your lower lumbar. So this was honestly probably the biggest game changer. Right, from here, we're going to tilt. We're going to lift one foot up off the floor. We're going to keep ourselves nice and still, and we're just pointing and bending the knee. So the main thing is kind of an isometric hold of having that pelvis in neutral and getting the pelvis used to it, getting the tummy used to it. The other thing we do here is we try not to move anything else. So the only thing that essentially should be working is your leg moving. Do one more, and then we're going to come out of it, and then we're going to come up. Okay? Then we're going to do some breathing stuff. So making sure the pelvis is tilted, the back is nice and flat. And it's something to just tell people. If it was a guy I was speaking to right now, I would kind of tell him to put an extra inch in as he does that tilt. That's how they click, essentially, where they're meant to cue. Cool, and relax there. Okay, so while we're doing this little tilt here, I want you just to have that position, and now do a nice exhale breath. So inhale, pop your hands on your tummy, exhale, inhale. Now you should feel, as you exhale, that the tummy caves in a wee bit, or it comes down, it flattens. As you inhale, your tummy fills into your hands. So exhale, allow it to flatten. Inhale, allow it to fill. Again, exhale, flatten. Inhale, full. Now we're going to come up into that leg up again. And as we go away, I want you to exhale, inhale, exhale. As you take the limb away, inhale, exhale, inhale. Now we're going to get opposite hand. We're going to tap that knee, and we're going to go exhale and take arm away. Exhale, inhale back together. Exhale, inhale. I want you to make a forced breath. Exhale away, inhale back in. Exhale away, inhale back in. Exhale away, inhale back in. Now we're changing sides. So again, exhale away, inhale back together. Exhale away, Inhale back together. Exhale away. 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 Inhale back together. Right, have a wee moment there. Allow your back to relax, okay? So it can take a wee while for your back to actually feel comfortable, and for some people it might be quite tight, so we need to allow the body to just be able to move and get mobile, okay? Once we start moving, it should ease up a wee bit. So we're going to stick the feet together now. And so we're just having a wee thing where I'm going to let you drop the right knee down, but we're keeping the feet together, so it's not, you're not going like that. We're just coming in, but we're making sure that pelvis is tilted first, so the back starts off flat, coming out. The other leg shouldn't be moving, so we want to keep the pelvis as still as we can in that neutral position. So we're going out, going exhale away, inhale back in, exhale away, inhale back in, exhale away, inhale back in. Two more, exhale away, inhale back in, exhale away, inhale back in. Right, changing sides, so exhale away, inhale back in, 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 exhale away, inhale back in. Two more, exhale away, inhale back in, exhale away, inhale back in. Give it a wiggle, allow things to just relax a wee bit. Bring your feet into hip width apart. Okay, so this one here, we're going to take one leg up off the floor, so we're tilting pelvis. We are going to come out to the side, okay? We're also not allowing the opposite side to move. We want to keep the foot and knee in the same place. My thing's about to fall down. I'll deal with it later. It's killing me right now. Right, so we're coming up. We're going to keep the leg, foot in line with the knee. Didn't want it rolling down on top of me. Exhale away. Inhale back in. Exhale away. Inhale back in. So we want to keep foot and knee in alignment, so they're not really, the foot is not visible. It's kind of hidden behind that knee. That's it. Two more here. Then we're going to go long. So again, making sure we're set up in that nice pelvic tilt. So the neutral pelvis, back's flattish. So exhale away. Inhale back in. Now this one here, when we talk about the exhale, the exhale is meant to happen on the hardest part of the movement. Now these exercises may not feel hard, but what we need is the brain to talk to the core, okay? And that's what happens with the breathing. Now sometimes when it's actually coming back in is the hard part, okay, coming back to center. So for you, it might be you inhale as you go away, and you exhale as you come back in. It's all person dependent. It could be that your hamstrings are really tight in this position. We're going to change sides. We're back into the bent knee and we're coming out to the side. So your hamstrings may be super duper tight, so it's actually harder for you to control coming back in. So you want to adjust it. So it might be that as you come back in, you exhale. As you go out, you inhale. But again, we're trying to keep everything else super duper still. So, and Then we're going to go out to the side. So again, work with what is your hardest bit. Is it going outwards and not toppling over, or is it coming back in because everything's tight? Work it out, and then we go exhale on the hard part, okay? Inhale back out, or it might be inhale on the in and exhale out, whatever works. Remember, we don't want the opposite side of the body doing anything. It should be feeling like it's holding it in place, but it should not be doing anything crazy. Cool, and have a wee relax there. Okay, so from there, we're just going to go up into a tabletop. Now, if you've had a back injury, this might be too much for you, okay? And the other thing you can do is actually have a chair or I'm just going to remove this here, a chair or a exercise ball, okay, handy, and it may help take the pressure off the lower back, okay? So those are options. Otherwise, we're just going to go into it with one leg. So again, we're going to go tilt the pelvis first, take a leg up and put your big toe on your chair, take another leg up, put your big toe on your chair. If you're fine here, you can take them off, okay? Otherwise, keep them rested on, and that will take the pressure off that lower back doing too much at this time. That will be a progression you would make as you go on. You go, right, I'm going to try it without using something to stabilize, okay? So I'm just going to do the basic one where we're resting, and we're just going to straighten the leg and come back down to rest. So it's just lightly holding there, okay? Nothing too insane. Again, hardest part, and it may feel super easy. If it does, exhale as you extend, inhale as you pop back down into tabletop, okay? We want it to be not making it shake or anything. It's not a intense thing, but we want to feel like there is something keeping this still. It's not going to be excessive. We're not crunching or anything like that, but we want to make sure it's keeping this area as still as possible. That's its current job, okay, to stabilize. Okay, from now we're going to come up and we're going to lower down. If you've got the chair, you can tap it on the back, and we're just going to keep that big toe resting on that seat, not allowing the pelvis to tilt away from us. That's important. Cool, and we'll go one more here, and then changing sides. So straighten, tap, coming up, tap, coming up, tap, tap. Two more, that's it. Cool, and have a moment here, okay? From here, I want you to bring your ball of your feet and your heels together and just press them in, and you're coming out. Now, this can be done away from the thing. And the other thing is, the closer your knees are to your face, the less pressure it does put on your lower back. So if you bring it in a wee bit closer, or if you take it away, you'll feel more activity in that lower back. Okay, so just something to think about. So exhale as you come together for this one. Inhale as you go away, or your knees go apart. Almost done. And have a wee moment here. Okay, we're going to push that away. And I just want you to do a bit of a stretch here. So we're going to get our fingertips as far away from our toenails as we can get them. And then we're going to relax. Fingertips away from our toenails. Relax. Two more. Fingertips away from toenails. And relax. Okay? Then we're going to pop onto our hands and knees. Going to pull the spine up towards the ceiling, tucking chin in towards chest, head forward, butt out. Coming up. Head forward, butt out. Coming back up. Cool. And one more here. And sinking down into it, okay? Turning forward. And out. Okay. Just from here, I want you to think about how you focus on your pelvic tilt in this position, okay? So when we're on our hands and knees, if you can see yourself in a mirror, have a look. But have a look for rounding of the lower back, so kind of like that. So we want to take that out. So same thing, your laser beam now is pointed straight down at the ground. Okay, and we're making sure we're not pointing between the legs or up towards the hands. Okay, so somewhere in the middle is your happy position, okay? So we're trying to work out where that is for you when we're doing this. Right, we are all done. But have a wee play around. Just doing that as a bit of a warm-up for your day can actually help make things better, because back pain is not pleasant, but it is something we do have to get the deeper core muscles to work, okay? And those are the ones that help with things like coughing and sneezing and like bracing yourself. When we talk about bracing, as if someone's going to crash into you, that kind of thing, not like that you normally do. So it's not a feeling, it's more of a stabilize and get everything in the right position feeling. Hopefully that makes some sense. I didn't womble on too much today. Thanks for hanging, and catch you next time. See you later.